I'm the network architect for WellSpan Health Systems. We are based in central Pennsylvania. We're a not-for-profit, community-based health system. We have about 93 remote locations. We have 4 major hospitals, and about 12,000 employees work for the organization. My responsibility is all connectivity throughout the entire enterprise, whether it be wired connectivity, remote access, or wireless connectivity for clients or servers. We have that responsibility. Right now, throughout WellSpan, we have about 47,000 active network ports in the environment. So the core networking solutions that we've done is we've implemented some carrier equipment. We've built our enterprise as a carrier-grade network. So we have ASR 9Ks, Cisco ASR 9Ks in the core. Then our Nexus 7Ks provide access for our data center, and there are cores in our data center. We go down to Nexus 6Ks and 5Ks as our distribution, down to 2Ks as our access switches. Now, Terakai has also helped us out with the remote sites, all of the routers and the switches and everything that we need for connectivity at the remote sites. And it would be to provide switching infrastructure, to be able to do the PoE that we need to provide power for APs, IP phones, or any other device that would be out there. Terakai has helped us develop solutions on how we can connect the most efficient way to connect our remote locations. And we've worked on everything from routing protocols to specific products. And we've developed standards. So working with Terakai, we develop standards across the enterprise. So we can call Terakai and say, hey, we're bringing up a remote site. And they can crank out a standard order, say, yep, here it is. We have everything built on standards. This way, if there's a failure, we don't have to spare as much. We can spare the products, and our return to service is a lot quicker. By working with Terakai for software standard, hardware standard, for all of that, for all of our infrastructure, it has really helped us to become very stable within our enterprise. Terakai has made our job easier because they've learned our environment. It's a partner relationship. So our sales rep and the engineers that support us on the Terakai side, they work well with us. They know our environment. They've taken the time to learn what we do. We've met with them countless times to talk about direction. We do strategic planning with them on here's what we'd like to do, here's directions. And we do it as a back and forth. What we're looking for is somebody that's gonna say, here's our plan. This is our design. It's not what can you do for me today, but let's talk about a 5-year strategy. Before we worked with Terakai, we had another partner that we were involved with, but that partner was just orders. It was straight orders. We knew that growing and moving forward, in certain areas, we're not gonna be the subject matter experts on some of this because we're not going to do it all the time. We needed somebody that we could partner with, somebody we'd lean on to fill the gaps. And that's where we went with Terakai. There's a lot of capabilities within the organization that can help us. We rely on Terakai to do all of our wireless surveys. We rely on Terakai to help us with core design, to help us with IPv6 planning, to help us with strategic planning and direction. And then they help us trying to work within the budget constraints that we have. Just because at the end of the day, it's all going to be about what we can actually afford to do. And Terakai is very good at helping us and coming up with creative solutions. Our doctors have developed stroke protocols to help patients when they come into the hospital. If they come in the ED and they're coming in the middle of the night, we have a neurologist on call. He's got an HD video conferencing system sitting in his house. The neurologist from home, within a matter of minutes, can be talking to the patient, interacting with the patient. Wireless relies on the infrastructure. The switching infrastructure that we get from Terakai, the designs that we've done with Terakai, that data getting back to the data center, the ability to go out to the internet through all of that technology so that the doctor at his house can go through the internet, video conference with that patient, and hopefully improve that patient's outcome. There's a lot of behind the scenes stuff that people don't see. It doesn't matter who gets the credit. If the doctor gets the credit for, hey, doing a great job, then we can stand back and just be proud for the infrastructure that we put in place that allowed that doctor to help that patient and have a positive outcome.